heroin, drugs, addiction, dependence, depression, morphine, opium, opium poppy, psychosis, euphoria. The heroin arose from a chemical reaction of morphine and acetic acid. It should be a drug which should cure morphine addicts with its heroic qualities. What, however, did not turn out well. Heroin is the most addictive known drug. This one arises at an opiate high. The intensive but short euphoria, one of the main reasons for it might be. The sense of time also is disturbed deeply. Syncs with a dependent heroin consumer of the morphine mirrors. He goes through, from time to time, also by a further consumption, following symptoms: sensitiveness, depressive feelings, sweatings, stomach intestines malfunctions, rashes, angina pectoris amounts, dysmenorrhea, amenorrhea and power reduction with degradations of the gonads, however no hereditary defects. Furthermore, consumers suffer from solid cognitive malfunctions up to psychotic symptoms in the course of the time. The person affected can turn out for the drug-related crime and obtaining prostitution into the difficulties. At the withdrawal, persons affected will be weak, yawn, sweat restlessly, a watery secretion flows from eyes and nose, they fall into a sleep rolling, after awakening considerably stronger watering and retirement, dilated pupils of secretions, strong and an intensive one, cold goose flesh, stomach and intestines contract solid, diarrheas and frequent vomiting, solid chills, twitchings and pains of the musculature. There hardly are quiet moments. Due to this distinctive symptoms, a withdrawal is only stationarily possible. Detailed overview. The heroin is a powder won from the raw opium of the opium poppy by chemical processes, more deadening and at the same time euphoria effect. Heroin is part of the illegal addictive drugs. The possession and cultivation as well as its trade after the narcotics law are forbidden and are pursued criminally. A quick look in story and origin. The natural origin plant of the heroin is poppy. Its most important cultivable areas on a geographical stripe of Turkey over Iran, India, Afghanistan, Pakistan, Golden Half Moon, Golden Triangle, draw itself up to the southeast of Asia. Meanwhile, poppy is cultivated again also in African South America. The history of the opium poppy as a remedy and as a high drug reaches back presumably millennia. So 4.000 BC already shall having been of use his healing and intoxicating effect for Sumerian and Egyptian. The opium poppy held move with its cultivation in China in the traditional Chinese medicine, which used primarily the oily poppy seeds as painkiller. At 1500 the opium meal arose in Persia and Turkey and became smoking opium pipes a fashion in China toward the middle of the 17th century, which led to great addiction problems very soon. The negative consequences of smoking opium arranged for the Chinese government in the further course in history repeated to state countermeasures. These from the resulting import ban actuated the so-called Opium Wars in the 19th century, in which Great Britain primarily colonialistly fought against the trade restrictions. The poppy seed culture in China reduced on a governmental level and the illegal cultivation was put under most severe punishments in 1906. After the German pharmacist Friedrich Wilhelm Serturner 1806 had managed for the first time to isolate the main active agent of the opium, the alkaloid morphine, the substance 1828 of the company Merck, one strong painkiller was put on the market. In the German-French War 1870-71 morphine was already used on a large scale at the treatment of injured persons. It was the consequence that numerous injured persons got morphine dependent, with the aim of creating a drug like one which is pain-killing and not producing dependence. However, 1874 became for the first time the so-called diacetyl morphine synthesized. It more retardedly was produced by the paint factories Bayer in Elberfeld in a big folding rule for almost 25 years and under the name Heroine commercializes among others as a means to the cough suppressing, as painkiller and for the treatment of morphine dependence. It turned out, however, fast that, only around a multiple, this means is not stronger than morphine but also has an even considerably higher dependence potential than this. At first, heroin was classified as anesthetic only, available on prescription, and been subject to strict international trade restrictions before it was finally forbidden in most countries due to the heroin still is used occasionally for the pain treatment of patients suffering from cancer in Great Britain, while it is not used in Germany any more than drug. With the ban on the substance, the illegal trade started with heroin simultaneously and flourished particularly during the Second World War. Heroin appeared there for the first time over U.S. soldiers stationed in Western Germany in 1968. The substance is offered powderedly as straight heroin in little packets. As a rule, the active agent concentration hesitates between 5 and 30%. Primarily in Germany, injecting intravenously is lasting the most common consumption form, more is in Great Britain and in the Netherlands on foil, smoked or snorted. Out of fear of the danger of infection connected to splashing, these consumption forms increase also in Germany, though the typical of the intravenous serving fails to appear. However, flash, the presently noticeable elation, out, and due to the lower effectiveness, larger quantities of heroin are required at this. Particularly accustomed consumers therefore usually go over to splashing again. The heroin powder is frequent under putting into action of citric acid removed by heating up and pulled up by cotton wool or cigarette filter, filtered and for an injection into water. For smoking, the heroin is given chasing of the dragon and heated up slowly from below, most on aluminum foil. The heroin steams arising from it are one vacuumed with a pipe. At the cold, heroin is retracted by a small pipe like the cocaine into the nose. The oral taking place in heroin, however, hardly a role, since the effect on it only develops itself very slowly and little intensively. At existing dependence heroin consumers between 0.5 and 3 need grief heroin per day, distribute on 3 or more injections. At not acclimatization, these would fatally repeatedly work. The effects. For the effect of the heroin, primarily the basic state and the needs of the consumer are decisive, while the surroundings in which consumption takes place are playing a rather subordinate role. As a rule, work euphorogenic calming heroin, easing in pain, removing consciousness, decreasing and strongly at the same time. Heroin muffles the intellectual activity and removes negative feelings like fear, listlessness and emptiness. Problems, conflicts and loads of the weekday are not perceived any more than such. Unpleasant perceptions and stimuli are removed. The consumer feels happy and content. The effects occur already shortly after the serving. Mode of action. At an intravenous injection, the active agent reaches the brain over the bloodstream very quickly and immediately works on the central nervous system. There it collects at certain receptors and it influences the activity of the cells by an effective neurochemical, impedes gamma-aminobutyric acid system, GABA system, in this place. In turn, a disinhibition of the post-connected dopamine system, which is for the reward mechanisms and presumably responsible for the lust experience, arises from it. The secretions of the substance are mainly carried out with the urine, in which heroin is heavily specifically provable. And the risks. A number of acute risks which is justified primarily in its strong effectiveness is, besides the danger of a dependence adapting quickly, see below, and the physical and social consequences connected with that, also connected with heroin consumption. So an only low room to move passes between compatibility and more toxically effect, which starts already at 5 milligrams, if somebody is not used to the substance. A before usual dose already can too serious till fatally ending complications lead after a short time physical withdrawal, too. But a continuous heroin consumption also can end with a fatal poisoning. This is primarily possible then if, because of the strong physical acclimatization and the relatively short working duration of the substance, the set and frequency of consumption must be increased very quickly to counteract the physical withdrawal. Symptoms. A heroin poisoning lets itself be seen into unconsciousness, respiratory depression and circulatory failure with slowdown in the cardiac activity. Most deaths because of an overdosage can be explained by the paralysis of the respiratory center. A special danger connected to the unconsciousness is suffocating to broken open. Pulmonary edemas and embolisms also can appear as a result of a heroin poisoning. Since heroin is sold in active agent content of up to 95% in very different qualities to be hardly checked by the consumer on the illegal market, it also can come to a fatal overdose due to particularly pure heroin or because of poisonous additions. A great risk of infecting himself with venereal diseases, HIV or hepatitis, for example, arises from the use of not sterile syringes. In addition, on a long-term basis, resultant damages. By a continuous heroin consumption, it comes to numerous heavy subsequent malfunctions of primarily physical and social type. A large portion of the physical resultant damages is in a close connection with the special serving form of splashing and the way of life with addicted to heroin health charging generally. A strong social impoverishment has to be usually watched, connected with a distinctive physical fall. Liver damages as well as stomach and intestines malfunctions are part of the most frequent physical resultant damages up to the intestinal obstruction. Strong teeth changes by caries and tooth failure as well as illnesses of the breath organs, particularly the lungs. Because of the intravenous serving, it frequently comes to local infections, for example in the form of abscesses or inflammations of lymphatics or cell tissue, to heavy degradations of the veins and to heart inflammations. Consumers do not seldom incur arm, leg or fractured skulls in the drugged state or in the context of brain cramps. Moreover, it can to impotences due, with women, to menstrual irregularities come with men. Changes are primarily connected to the personality and the social situation besides these serious physical consequences with chronic heroin consumption. Drug-related crime and prostitution frequently result from the high need for heroin and the costs connected with that, what usually already leads within the short time to neglect and social isolation in connection with the strong drug consumption. The question of the dependence. Heroin is regarded as the addictive drug causing the most effective physical and emotional dependence which is at present known. Depending on individual influence factors, the dependence can take shape already after short-time regular heroin consumption, with all results. Heroin acts far stronger and with a considerably shorter working duration than morphine. A very quick acclimatization typical of heroin and tolerance formation join there. As a consequence, the substance must be supplied with to the body in shorter and shorter distances and in higher and higher doses to counteract the withdrawal symptoms adapting fast. These reach of proportionally slight symptoms like sweating, freeze and trembling to strong rheumatic pains, sleeplessnesses and heavy circulation collapses. The euphorogenic effect of the substance therefore is not anymore in most cases of a heroin addiction in the foreground, but it rather is all about to maintain a normal condition without the described withdrawal symptoms. Dangerous mixtures. Some consumers mix heroin with cocaine for a so-called speedball or cocktail. Since the different substances increase mutually in their effect, this mixture is dangerously regarded as special. Heroin also is described as a euphoriant together with other opiates.